Tomorrow will be 3 months since former President Jimmy Carter started home hospice care. It's helping bust the myth that hospice is only for the last hours or days of someone's life. 11 Live's Christy Diaz is joining us live from the Carter Center. Christy, hospice care is also being used as a solution for another growing condition.
Hospice is increasingly being used to help treat people living with dementia. I spoke to a hospice company based here in Atlanta. They're the first in the metro to go through a specialized dementia simulation training, and they say it is changing the game in the way they provide care.
What percentage of the patients do you work with, would you say, are living with some form of dementia?
60% of ours. It's the #1 diagnosis on our program.
When Capstone Hospice CEO Hugh Henderson first started in the business 30 years ago, he says cancer patients were the majority by far. But as treatments for cancer have gotten better, neurological illnesses have outpaced them, and it's changing the way they need to provide care.
Caring for someone with Alzheimer's dementia is not the same as caring someone with pancreatic cancer.
So Hugh brought in a training group called Educate. It provides a dementia simulation training to help people experience firsthand what it might be like to have dementia. Participants wear headphones that play sounds to simulate the inability to filter out background noise, glasses to simulate the tunnel vision people with dementia often get, and gloves to make it harder to perform fine motor tasks like buttoning a shirt.
Zip the vest and place on a hanger.
And then with all of that, an instructor calls out instructions to follow.
And those 10 minutes are so life-altering. People come out of that experience and they go, I had no idea. Literally, I had no idea.
I was irritated, annoyed, lonely, and foolish because I was given instructions, but I couldn't really hear. I didn't know what to do. That is empathy overload.
And that's exactly the goal, to infuse more patience, compassion, and understanding in the people tasked with taking care of the people who need help.
Did you say I love you? Take me home?
Paul Enger's wife, Patricia, has been with Capstone Hospice for 3 years as she lives with late-stage dementia.
Once you understand what this disease is really doing to that person, you're more compassionate, you're more patient, you're more loving, you're more giving.
This training is already changing the way they do things, specifically around eating and bathing. Things like thinking, okay, the vision changes, maybe that's why they're reaching for the other person's plate. That's moved their plate over. Or if they're fighting you bathing, maybe it's because the way we put them in the water hurts them. Everything is helping the way that they provide care. And the nurse in charge of onboarding says every new hire will get this training.